You must have seen advertisements like this on social media and on Google many times. Stool donors wanted. Do you want to save lives by donating stool for the manufacture of fecal microbiota transplant? Get reimbursed up to 200 sterling pounds for your time. Poop that saves lives. The future of gut treatment. Fecal microbiota transplant and stool donation. Do you know that your stool, yes, your poop can actually save someone's life? Around the world, doctors are using something called fecal microbiota transplant, and it has changed the lives of patients who had no other hope. Today, I'm going to tell you how stool donation works, why the gut microbiome is so powerful, and how this therapy might revolutionize the future of GI diseases. Why is this even needed? Every year, millions suffer from severe gut infections, irritable bowel syndrome, inflammatory bowel disease, antibiotic related gut damage, Clostridium difficile infection, a deadly infection where antibiotics often fail. The root cause of many of these conditions is gut dysbiosis, meaning our gut bacteria are damaged, missing, or unbalanced. When the gut loses its healthy bacteria, medicine alone sometimes is not enough. The gut microbiome, our hidden super organ. Your intestines contain trillions of bacteria, collectively called the gut microbiome. These bacteria help digestion, control immunity, produce vitamins, protect against infections, even influence mood and brain health. Scientists now call the gut the second brain. So, what if we could restore these bacteria in sick patients? What is a fecal microbiome transplant? Fecal microbiota transplant is a treatment in which stool from a healthy donor is processed, purified, and then delivered to a patient's colon through colonoscopy, capsule from poops, pills, or enema. Why? Because healthy stool means healthy bacteria. And once these bacteria enter a patient's gut, they fight infection, restore balance, and rebuild the microbiome. Fecal microbiota transplant has a 90% success rate for recurrent Clostridium difficile where antibiotics fail. FMT works. Stool donation, like blood donation, but for the gut. Just like we donate blood, plasma, or organs, stool donation is now a reality. Donors are not patients, they are healthy volunteers. Hospitals screen donor thoroughly to make sure their stool contains the best gut microbiome. The basic eligibility is age 18 to 50 years, healthy non-smoker, no long-term illness, and no recent antibiotics. So if your age is between 18 to 50 years, you are healthy, you are non-smoker, and you haven't got any long-term illness, and you haven't used recent antibiotics, you are donor for fecal transplant. A healthy donor can help dozens of patients. Safety and screening. Donors go through blood tests, stool tests, and lifestyle screening. The donor stool is processed in a lab, purified, and checked before use. This ensures the therapy is safe, clean, and medically controlled. Future of fecal microbiota transplant, it's beyond infection. Research is exploring FMT for ulcerative colitis, Crohn's disease, irritable bowel syndrome, obesity, fatty liver disease, autism spectrum related gut issues, and even depression and anxiety, that's the gut brain axis. In the future, we may treat many chronic diseases not with drugs but with microbiome therapies. Why public awareness matters? Millions could benefit, but research needs donors and awareness. So people don't react with shame or shock. This is science, not stigma. So my final message to you is, if blood can save a life, if a kidney can save a life, then a healthy stool can also save a life. Fecal microbiota transplant represents hope, healing, and a medical revolution of the future. Please spread this awareness. Please talk about it. Please support research. You might save a life someday. So like, share, and discuss this powerful therapy, because gut health is the future of medicine. Thank you for watching.